In this video, we'll talk how HIV affects the immune system and how HIV is the retrovirus that eventually causes AIDS.
NurseGetsZen chapters are about 50 pages long, and half of the time you can't tell what is important. This video will help you to see it all fast. If you are a nursing student, this could save you hours of rereading. And if you are here just to better understand the conditions, I hope this makes the topic feels less intimidating. Hi friends, and welcome back to my channel. I am Nurse Mia, and this is part 2 from the Surg chapter, the outline from the GetZen RN study group series. Before we get into the details, I always like to zoom out first to look at the big picture of the chapter. I use a concept map like these to break it down heavy chapters so you can see the full path of disorders, lab intervention, all at a glance. You'll know exactly where to zoom in and what to prioritize. It takes the pressure off and makes the chapter easier to follow. Comment below which section of this chapter feels the most overwhelming for you. The goal? One page of clarity you can revisit in minutes. A map turns 60 pages in 10 minutes of review. Clean path, less noise. You will know where to start and what to skip. Let's get started.
HIV is a retrovirus that primarily targets CD4 plus, the T helper cells. As viral replication progresses, the immune system becomes increasingly compromised, making the individual susceptible to opportunistic infection and AIDS-defining illness. So in this chapter 22, we talk about coordinating care for patients with HIV. Welcome to chapter 22, Coordinating Care for Patients with HIV. Introduction. So the HIV disease is a chronic illness with multiple stages. As progressing from acute infection leads to AIDS and then death without treatment. The survival time untreated HIV is 12 years into United States and less about 5 years in limited resources countries, worsened by TB, malaria, and malnutrition. The first AIDS case reported in 81, pneumonia in gay men. In 85, HIV antibody tests available were showed HIV could exist before AIDS symptoms. In 86, CDC established the 4 stages classification system, and how HIV infection classified in 3 stages based on CD4 plus count. So the CD4% of lymphocytes or AIDS defining condition. The key point, once classified in a higher stage, the patient cannot be reclassified to a less severe stage, even if immune function improves. The World Health Organization also has a separate classification system, slightly different than CDC, which allows movement back to less severe stage with treatment. Global statistics. In 2020, the World Health Organization established that 37.7 million living with HIV. is no vaccine yet due to constant viral mutation. Prevention stages critical: condom use, reducing IV drug risk. HIV is primarily transmitted through sexual contact, IV drug use, and vertical transmission. African American represent 45% of new cases in the United States, followed by Latinos at 70%. So we'll see here as we go. Let me get my light. I classified the chapter, and now I'm going to show you my brain map, how the chapter, we can follow the chapter stages. Chapter 22, and I just talked an overview about HIV and AIDS earlier. Now we're going to move on the big section of the chapter, the HIV and AP patho clinical manifestation. Here are the interprofessional management with nursing and medication diagnostics. And here there are some very good tables, and here is the stages. Like in AP and patho, we talk about stages of HIV and AIDS. So take a glance, take a short screen, and we move to deep into the chapter. So the HIV has no cure exists for HIV AIDS, but medication can control HIV and prevent disease progression. With treatment, most people with HIV in the US don't develop AIDS. So rare, fewer than 200,000 US cases per year. So it spreads by sexual contact. Treatment can help, but this condition cannot be cured. Chronic can last for years or be lifelong, requires a medical diagnosis, some lab tests or imaging are always required. So how it spread is by blood products, unclean needles or unscreened blood, by having unprotected vaginal, anal or oral sex, from mother to baby, by pregnancy, labor or nursing. And as we see here, worldwide in 2020, there are some statistics. In the United States, African American men who have sex with men, most affected demographic, US, states with higher rates in DC, Georgia, and Florida. And we're moving forward. We are in pathophysiology. So we know in pathophysiology that HIV targets the CD4 plus cells, the T helper lymphocytes, leading to a gradual loss of immune defense. Once affected, individuals undergo in acute viral infection and seroconversion, asymptomatic chronic phase, symptomatic chronic phase, and AIDS at the end. And here we have the immune system roles is to destroy infection agents, abnormal cells, foreign objects. The HIV pathogen, the virus attacks the CD4 T helper cell, integrates into the DNA via reverse transcriptase. I think you remember in microbiology the system, like how the DNA and RNA will duplicate. So this actually goes there inside that. CD4 plus cell destroyed, immune system weakens. Without treatment, opportunistic infections occur. And yeah, a lot of infection like TB, here it's fungus, pneumonia, Kaposis, sarcoma. This is also it's increases and NCLEX a lot. So we move forward. We're talking about HIV infection stages, the four as CDC said. So the viral transmission, acute viral infections, and seroconversion. The virus binds to CD4 plus receptor and co-receptors. The rapid CD4 plus decreases, viral load spikes, the symptoms flu-like fever, aches, swollen nodes, and then the seroconversion, it's the antibody detectable, HIV test become positive. On the next stage, the two symptomatic chronic infection where the CD4 count rises again, viral load drops to a set point, immune system loads virus in check but not eliminate. So the average CD4 plus loss will equal like 50 to 100 cells per year, can last about 10 years untreated. On the third, the symptomatic chronic infection, it's where the CD4 counts declines, the symptoms frequent infection, skin problem, lymphadenopathy, weight loss. So without treatment, progress to AIDS in about 2 years. The last stage, it's acute immune deficiency syndrome, AIDS, where the CD4 plus count is less than 200 or presence of AIDS-defying illness. Example, the PCP, MAC, toxoplasmosis, candidiasis, recurrent pneumonia. Major target organ damage, renal, CNS, cardiovascular, peripheral system. So basically, HIV targets the CD4 cells, the T helper lymphocytes, which leading to a gradual loss of immune defense. Once affected, individuals undergo those stages. In our book, the table 22.2 links manifestation to probable causes, like example weight loss, disease progression, cough, so TB, pneumonia, severe headache, meningitis. So the general signs and symptoms: fever, cough, weakness, nausea, vomiting, diarrhea, tips, aphasia, forgetfulness, skin lesion, short of breath, headache, vision changes, pain, or night sweats, lymphadenopathy. So the clinical manifestation: opportunistic infections dominate clinical presentation. So the pneumocystis carinii pneumonia, the PCP, is the most common opportunistic infection in PLYH. Signs and symptoms depends on the specific infection involved. Keep in mind, this is the very urgent signs, so the new cough, damp, headache, mental changes, new skin lesion, new diarrhea, weight loss. We are in medical management, diagnostic testing. So we know that the frequency of screening based off risk factor. So general populations once annually, high risk individuals like sex work, IV, drug use, condomless sex, every 6 to 12 months minimum. Some experts recommend every 3 months for high risk groups. Patients should be informed before screening and cannot opt out. The diagnostics and screening test for HIV. HIV test detects antibodies, viral proteins, or viral RNA. Screening is crucial for early detection and to guide treatment decision. So types of HIV test is the rapid test, point of care test, quick use for quick detection in healthcare settings, occupational exposure, or labor delivery. Oral quick in-home HIV test, FDA approved, third generation testing using oral fluid. Results in 5 to 30 minutes. Positive results require laboratory confirmation via an HIV antibodies assay. Negative results do not require confirmation but should be repeated in 3 to 6 months if recent exposure is suspected. Fourth generation HIV test detects both HIV antibodies and the P24 antigen, which is a viral protein. Shorter detection window as early as 2 weeks post-infection. The enzyme-linked immunosorbent assay, it's ELISA, screens for HIV antibodies in blood, urine, or oral fluid, not saliva. Requires confirmation by Western blot assay detecting viral antigen. And number 4, polymerase chain reaction, PCR testing, HIV RNA test. Amplifies viral RNA, measuring viral load in the blood. Used for confirming HIV infection in infants less than 12 months, detecting acute infection in people with the window period screening donors. The laboratory monitoring in HIV management is where the CD4 plus count and viral load are primary markers of disease progression and treatment response. The CD4 plus count monitoring initial measurement at HIV diagnostic routine monitoring schedule every 3 to 6 months during the first 2 years of ART, annually after 2 years of successful treatment. As a CD4 count, it's less than 200 cells. Defines AIDS and increases the risk of opportunistic infection. So the viral load monitoring measured the amount of HIV RNA in the blood, key markers of ART effectiveness, monitoring schedule every 3 to 4 months for first 2 years of ART, every 6 months if viral load has been suspected for more than 2 years. Falsely high viral load levels can occur due to co-infection like flu, other viral infection. Genotype assay of ART resistance is the genotype testing at diagnosis, helps detect ART-resistant HIV strains. And let me get my light. So we have ages, the high risk, pregnant. So we moving forward. On medication for HIV treatment, and later we talk about prevention. We have goals of medication therapy, so to prevent opportunistic infection, to reduce HIV load to undetectable levels, to increase the CD4 plus count of immune function, to prevent HIV transmission and resistance. So the prophylaxis of opportunistic infections, it starts when CD4 plus count falls below specific threshold. So the CD4, it's less than 200 cells. Prophylaxis for toxoplasmosis and PCP. Then we have the less than 50. I'm reading from here. Prophylaxis can be discontinued once CD4 plus count remains above the thresholds for more than 3 months. And we have the antibiotic Bactrim is commonly used, but delayed allergic reaction rash may appear between 7 to 14 days after starting a treatment. Severe side effects, it's a hemolytic anemia and G6PD deficiency. It's a type of blood disorders that will be in different chapter, are more common in certain population, African, European, Asian descent. The ART, the antiretroviral therapy, ART is recommended for all HIV positive individuals. ART prevents HIV from replicating and increases D4 plus count. Most patients take 2 to 3 medications from at least 2 drug classes. Combination pills are available to simplify therapy. And ART monitoring and treatment goals. Before starting ART, evaluate hepatic and renal function to determine medication safety. ART affects CD4 plus count increases, HIV viral load decreases, undetectable within 6 to 8 weeks. Monitoring schedule is for viral load every 3 to 4 months initially, then every 6 months if stable, and CD4 plus count every 3 to 6 months initially, then annually if stable. The ART adherence, patient must commit to 95 adherence to prevent the drug resistance. Skipping doses leads to viral resistance and treatment failure. Treatment education is very crucial, covering like advantage versus disadvantages of ART, lifelong commitment to the therapy, medication side effects management, proper medication timing and adherence important. And we have the immunization. Immunization is the PLWH at increased infection risk, recommended vaccine, T-Tab, pneumococcal, influenza annually, hepatitis A and B, meningococcal HPV recombinant zoster. Contraindication is the live vaccine. So for the NCLEX or any quizzes, here the immunization, be careful, contraindication is the live vaccine, which is the mmR. If CD4 plus, it's less than 200, and is recommended a TAB, hepatitis A and B, zoster, and influenza. And so occupational exposure, report immediately, test resource if possible, initiate post-exposure prophylaxis. So also the FDA approved PrEP medication, it's the Truvada, reduces HIV transmission by almost 99% when taken as prescribed. Another one is Descovy, equally effective as Truvada, but not approved for people assigned a female at birth. Another one is cabotegravir, available as an oral PrEP for short-term use or long-acting injectable PrEP. PrEP monitoring, it's HIV testing every 3 months to ensure the person remains HIV negative. Hepatitis B screening before starting PrEP. Medication adherence is key to efficacy. And I think that's it for here. HIV care continuum cascade of care tracks patients from diagnostic to leakage to care, ART initiation, viral suspension. US data, it's about 87% know their status, only 25 achieve a non-detectable viral load. So screening, routine opt-out testing for age of 15 to 65. High-risk population, annual or more frequent, for instance, STI clinic patients, incarcerated. Prevention stages, ART as prevention, U, it's undetectable, untransmissible. Pre-exposure prophylaxis, so the PrEP. We talked earlier about Truvada, Descovy, cabotegravir, or oral or injectable. So indication needs serodiscardant couples, high-risk sexual behaviors, IV drug use, survival sex conceptions with HIV plus partner. So the barrier, it's the cause, adherence, limited awareness, and possible resistance. So barriers to widespread PrEP use include lack of awareness outside of clinical trial participants, high cost and limited accessibility, concern about long-term adherence and resistance development, potential for decreased condom use in high-risk population. So public health initiatives should focus on expanding the PrEP awareness and accessibility, especially for high-risk population, ensuring PrEP is covered by insurance or available at reduced cost, providing ongoing counseling on condom use and STI prevention. We have complication. We talked about opportunistic infection. So the CD4 more than 500, usually asymptomatic. Vaginal candidiasis may occur. CD4 between 500 and 350 increases respiratory infection. Herpes zoster. CD4 plus between 350 to 200. It's fever, fatigue, bacterial infection. CD4 plus less than 200, AIDS. So the opportunistic infection is such as PCP, cryptococcal meningitis, CMV, Candida esophagitis, toxoplasmosis. On malignancies associated with advanced immunocompression, example, Kaposi sarcoma lymphoma. 3, it's the immune reconstruction inflammatory syndrome, IRIS, occurs after ART initiation. Then inflammatory reaction to latent opportunistic infections like TB and PGP may be self-limited but severe or fatal outcome possible. So now we go to the last part of the chapter. We have nursing care assessment and analysis. Monitor for common symptoms like fever, cough, weight loss, skin lesion, dyspnea, night sweats, neurological changes. Track the CD4 plus count, viral load, weight, TB status, immunization, depression. 2, nursing diagnostics. We know it's a risk for infection, immunosuppression. And then we have imbalanced nutrition, less than body requirements, risk for fluid volume deficit, also anxiety. So diagnosis, disease progression, knowledge deficit to self-care, disease process. To the 3, nursing intervention for assessment, we always do vital signs. Low-grade fever may signal infection. Weight trends like less than 10% loss, worsening disease. So keep in mind this is low fever, feverish, or the weight trends. It's a tricky question. CD4 plus count, viral load, adherence to ART, immunization, and TB status. Also keep in mind what type of immunization I said earlier. Screen for depression stigma. To action, we know the universal precaution, hand hygiene, most very important. Administer ART on schedule, provide small nutrient-dense meals, offer emotional support, referrals to mental health social services. What we do about teaching, avoid risky behaviors, use condoms, no needle sharing, strict adherence to ART, infection control precaution at home, bleach cleaning, avoid raw foods, avoid pet, report urgent symptoms, new fever, neuro changes, new lesions, maintain preventive health screenings. 4, evaluating outcomes, viral load suppressed to non-detectable within months. CD4 plus count rises. Patient demonstrate adherence, reduce risk behaviors, and report symptoms promptly. Also, quality of life preserved with comprehensive care. On 5, transitional care. So the HIV, it's a chronic illness. address long-term issues, aging, treatment side effects, comorbidities, integrate palliative care early for symptom management and adherence care planning. So the nursing always we monitor response to ART and track labs results like CD4 count, viral load. So again, we need to educate patients about strict medication adherence, also to promote risk reduction behaviors and follow-up testing. Also, we need to provide psychosocial support to promote long-term wellness. So keep in mind few more key points. Priorities is to prevent transmission, encourage PrEP for at-risk partners, PEP after exposure, monitor for immune reconstruction, inflammatory syndrome, high risk, coordinate care with infection disease specialists, case managers, and pharmacists. Also encourage nutrition, vaccination, mental health screening, and support group participation. So we know that art is a core cornerstone of HIV prevention, and maintaining an undetectable viral load prevents sexual transmission. PrEP is a highly effective strategy for reducing HIV risk but requires strict adherence. So the public health efforts should focus on increasing PrEP awareness, reducing cost, and encourage risk reduction behaviors. So again, routine vaccination protects HIV positive individuals from severe infection. So the post-exposure prophylaxis, PEP, is essential for healthcare workers exposed to HIV. Routine HIV screening is recommended for all individuals aged 15 to 16 and earlier yearly for high-risk individuals. So patients should be screened for TB, STI, HPV-related cancer, and co-infection at HIV diagnostic. So routine CD4 plus count and viral load monitoring are essential for tracking disease progression. Rapid HIV tests provide quick results but require confirmation for positive cases. So opportunistic infection take advantage of suppressed immune system and cause severe illness. So HIV rapidly infects and destroys CD4 plus cells, weakening immunity. Without treatment, HIV progresses throughout asymptomatic to symptomatic and AIDS stages. So AIDS is defined by CD4 plus less than 200 cells or the presence of specific infection. HIV symptoms primarily results from immune system failure and infection. So I have a little bit more to show. I just found an online. So today it's October 2nd, 2025 when I record this, and I found a very interesting article and I read it. I hope you're going to read it as well. Now I'm going to show you the article. So this is the article. Researchers at Case Western Reserve University uncover HIV mystery that could unlock the path to a cure. You see, Health and Wellness, September 29, 25. It's a story by Patty Zamora. So this is the website. So it's case.edu, news research case. So basically, I think if you write this title, will pop up on in a search engine Google about this. So it's a case.edu news research. So this is a reliable research because it's edu research center. So please enjoy reading this. It's fun to understand more about this disease as you progress in nursing. So it's a good news. We have some good news in September 29, 2025. So it's very late, very recently. In this video, we learn how HIV affects the immune system. Checking out and see you next time.
Thank you so much for being here with me today. I hope this video helped make things feel a little clearer and less overwhelming. If this supported your learning, please give it a like or share it with your fellow nursing student who might need this too. Everything we cover connects back to the real nursing, wherever it's recognizing a lab, planning safe care, or knowing what to teach a patient. Let me know in the comments below, what was the most helpful thing you learned today? What still feels unclear or confusing? If this was what you hoped, and make it easy for you. If you can also let me know if you like the notes for this chapter. Check the description. I usually add some free resources there just for you. Thank you again for your time and trust. I'm Nurse Mia, and from my heart to yours, until next time, stay zen, stay grounded. Namaste. Bye for now.